All right, good morning all. Good morning. So today we continue with a lecture, the course GNP 123. And here we have some questions on the board, calculations. We will look at these calculations to refresh our memory on what we've done on this topic of a dilution and extending to dosage calculation. Am I complicating? Yeah. So now, from this question, from your past question, from your council exam, we have a question that says, if one tablet of phenobarbital is 80 milligrams, and a CHO prescribed that a patient should be given a tablet in a teaspoon 3 times a day for 5 days. How many tablets are to be dissolved and how many mils to be used? Now, they want to do what? They want to disperse. Excuse me. They want to disperse, or dissolve, as case may be, the tablet in liquid to form this will surely be a suspension. Am I communicating? Because most tablets, except if the tablet dissolves anyway, it will form a solution. I think we discussed this in English class. Most of the tablets end up forming suspension. Am I communicating? So let's use disperse. So the tablet will be dispersed. One tablet dispersed in a teaspoon. In a teaspoon with water, and that teaspoon, if you convert it to metric system, it becomes 5 ml. 1 teaspoon is what? 5 ml. And the instructions say that one of these tablets, the active ingredient in that tablet is what? 80 milligram what? Phenobarbital. That's active ingredient in a tablet. And if one tablet contains 80 milligram of what? Phenobarbital, and you disperse that one tablet in 5 ml to form a suspension, right? Which you now give to the baby. Now, you are told to give this suspension, this one that has been turned to in liquid form, to give to the baby 3 times a day. And each of them, that teaspoon is 5 ml, right? So that means in a day, 3 times, morning, afternoon, and that means how many ml is needed in a day? 5 ml plus 5 ml plus 5 ml, making it what? 15 ml in a day. So how many ml will you need for 5 days? You multiply that as 15 ml in a day. You add 15 ml, 15 ml, 15 ml into 5. All right, isn't it not? That means we are multiplying 15 ml by what? 5, which is what? 75 ml. So you need 75 ml. How 75 ml is what you need of water for that 5 days. Is it clear? Is this one clear? Is this one clear? Okay, come. Sit up, come here. Let's do it together, come. That's the basic to understanding. Come out. Come out. Fast. If I ask you now that in a day, you take 5 ml of water in a day. That's what I want you to take. You take 5 ml of water or a drug, and you take it 3 times a day. So how many ml will it take in a day? Answer me. 5 ml in a day. I'll take it for. You take 3 times. That's 5 ml 3 times in a day. How many ml will it take in a day? 5 ml in a day. I said you take 5 ml of water 3 times a day. So how many ml will we take in a day? 15. So I'm going to take example. The same way you took it 15 ml a day, make it 5 days. How many ml will take the entire 5 days? How many? 75. So what is there you don't understand? You understand now? Are you sure? Then now sit down. So what we need Because we are told that 1 teaspoon contains 5 ml, and we are told to take it, the baby, you should do it to the baby 3 times a day. So a day is 15 ml. So 5 days is how many ml? 75 ml. So we understood this one. Now let's look at this tablet. You also told that you are supposed to dissolve or disperse 1 tablet in that 5 ml. So how many tablets will you disperse in a day? 3 tablets, right? So for the 5 days, how many tablets will you disperse? 15 tablets, right? 15 what? Tablets. Any confusion? So that means the answer is what? 15 tablets and what? 75 ml. What they don't understand? Come out. Come. Let's do it together. That's the best way to understand it. So what do they don't understand?
How many meals
used when?
to be used in the 5 days?
How many meals will you use in a day?
It's 1 teaspoon.
It's what?
It's 5 meals.
Okay. Talk now. We are busy. We are serious here.
This 1 teaspoon is 5 meals.
Okay.
So, and in a day, like 5, as in a day, the drug is given 3 times.
Okay.
So, 5 times 3 times, it will be given in a day. 15.
15 mil, okay.
15 mil.
5 days income. All of 5 days. Duration. The duration is what? What is the duration of the treatment?
5 days.
Frequency is what? 3 times a day, right? But the duration is 5 days. So for that 5 days, how many mil?
15 mil.
So come. How many?
75 mil.
Okay, it's clear now, right? You can again see that. We know how to teach any category of people. That one is okay. She is not happy now. True or false? What is it? In the board. Hey, which kind of board again? Can you explain it? What she explained now? Can you explain it? So even if you can explain it, you can write it. Try to explain it. Let's hear you. I didn't say. I say explain what you understood. Come on. Don't be afraid. Come out. They are classmates. They will not eat you.
I understand that. According to what it says.
Okay.
The 1 teaspoon of megabitum contains 5 mil.
Okay.
So the 5 mil now, if you take it like 3 times,
Okay.
it will give us 15 mil. So that 15 mil now.
15 mil per day in a day.
So if you take that 15 mil times 5 times.
For the 5 days, you
5
take the drug.
it will now be
75 mil of. That's in summary. You just need 75. The total mil of water you need is what? 75 mil. Okay.
So my question is not that. If I want to write it, I'm just saying it in my mouth.
This you said now is what you write. I want teach you how to write.
Okay.
This you said now. If you know the way you said it, write it the way you said it. Okay. Is something here we say yes. See, conquer that fear. Write it down. Conquer that fear. Solve it. Solve it in your listen. Let's conquer the fear. Yes, let's conquer the fear. Yes. I understand where you're going to. I understand this. But I want you to conquer the fear. So that I will know. It's not just to sit down and be. I'll be solving a two of us. I'll be solving questions here. Now I started to sit down and watch it. You want me to go again and solve on the phone? Put it down. What you understood from what you explained now. Do it yourself. After all, if I give you assignment, well, I might want to do the assignment for you. Do it. Then you conquer the fear. In fact, do it and see what you did. Let's start from there. Articulate it step by step in your mind. Link it up logically. If a day 1 teaspoon is 5 ml, and the prescription says how many? Says what? Teaspoon. 1 teaspoon 3 times a day. That means the number of meals in a day is how many? How many meals? 3 times 5 meals, which is what? 15 meals. As the answer not come out, you now say, okay, a tablet should be dissolved in what? 1 teaspoon. Therefore, the patient or the child needs to take how many tablets in a day? 3 tablets, because you're going to take it 3 times a day. It's not true. So 3 tablets, 1 tablet times 3 is what? 3 tablets a day. But the duration of treatment is how many days? 5 days. Therefore, the total tablet for the 5 days is what? 3 tablets times 5 days, which is what? 15 tablets. About July. It's simple. Just write it. I want to see you write it. Articulate it in your mind and write it. Let's learn it together. Don't be afraid. You can conquer it. I know the problem was some of you. Some didn't ever believe that they can come in contact with calculation again. So I understand. True of us, I understand. So some did see bonari and again. Now, hey, I'm in you. Thank God. You see me take after with calculation of pharmacology. So yeah, I understand it, but don't be afraid. You conquer it. These are things you meet in your practice. You must meet them in your practice. There are some irremovable villages you will go sell. You will see a doctor there. True of us. You will see a doctor there. You won't even see a registered nurse there. You will be everything. So you should be able to do what? Dish out some things. Save lives. That's why you don't even need. Try to expand on your knowledge. Don't just based on what you are taught in class alone. It's good to at least start from what you're taught in class, then expand by yourself and develop yourself, because the challenges you meet in the field, in your place of practice, you may be surprised. You start asking yourself, am I a doctor? Am I a nurse? That life must be saved. True of us, what are you going to do? You must help out. Are you done? Let me see what it is. 1 teaspoonful. 1 teaspoon of propranolol is 5 ml. 1 teaspoon is 5 ml. 3 times. What is it? No, you jump. You don't put this one. Just simply say, Zara, can you read an board? Let me see what it is. But I don't think that is the best thing to do. Is spoon feeding people. This thing is the smallest of the preparation here. Where is the solution? Where did it start? Okay, you say how many times did should be given? 3 times. Okay, good. 3 times in a day. And in 1 teaspoonful. 3 times in a day. What is this?
3 times in a day in 1 teaspoon. As in each.
1 teaspoon each, right? Is that what you mean? So 1 teaspoon is 15. We know it's 5 ml. It's 5 ml. Then we have 5 ml times 3 times in a day, right? Don't worry. Let me state this one. I can see that some of you are still having issues here. Let me state. Just look up. Let me just state it logically, okay? All right. Now look up solution. Now, the first to do is this. We are told that 1 tablet of phenobarbital is 80 milligrams. Am I communicating? Listen, if you're not careful, if we hear that, we know it's 80 milligrams, but if you're not careful, you're cracking your brain on this 80 milligrams. You will not use it in this calculation. Hello? You will not use that 80 milligrams in this calculation. No. There are type of questions they will ask you. How do you mean they ask you, how many milligram? In fact, let me add it. How many tablets are to be dissolved? How many tablets are to be dissolved? How many mils are to be used? How many milligram of phenobarbital should be used? How many milligram of phenobarbital will be administered to this patient for the 5 days? Is it clear? I added something in that question. Yes. How many milligram, that mg, of phenobarbital should be administered to the patient in 5 days? In the 5 days. So that means first one is tablets, mils, and what? Milligram. Is it clear? Yes. Tablets, mils, and what? Milligram. Yes. I see that I added I in that question. I added the third part of the question. When I added something. I want you now to calculate how many milligram of phenobarbital that should be given to the patient for that 5 days. How many milligram of phenobarbital? That's the third part of the question. First one says you calculate the what? How many tablets for that 5 days, right? Right? Then the second one said you should calculate the number of the mils of water, right? You need, right? Or the mils. Yes, mils of water used because it's water you are using here. Or unless they specify, but if they don't specify, use what? Water. Then the third one, part of the question is to calculate how many milligram of what? Phenobarbital should be administered to the patient for that what? 5 days. So if you are done, let me calculate it. So I'm in the first part. Hello? But before I go to the I want to do some preamble, some conversion factors. Or let me just continue. I say how many what? Tablets, right? You are told that one tablet of phenobarbital is 80 milligram. And ACO prescribed that a patient should be given a tablet in a teaspoonful, 3 times a day. So, how many tablets should be given in a day? Each time they give a teaspoon, how many tablets was given? 1 tablet. Good. So, number of tablets. To be given in a day is equal to what? 1 tablet, right? Times what? Which is what? 3 what? Tablets per what? Day, right? So, therefore, number of number of tablets to be given for the 5 what? Days is equal to what? 3 what? Tablets per what? Day times what? 5 what? Days. Day will cancel what? Day. 3 tablets times 5 is equal to what? 15 what? Tablets. Udaya? So 15 tablets should be given for the 5 what? Days. That's the first part of the question. That is I part of the question. Then I. If you are done, let me clean so I can write the second part. The I part. I can solve the I part. I don't think this place will. So some of you may not see this place. So just let me clean this place. What do you use to clean the board? Is it this thing? Huh? Please, right, let me continue, please. So number of tablets to be given in a day is equal to what? 1 tablet times 3 times, right? Yes. Then which is what? 3 tablets per day. Therefore, number of tablets to be given for 5 days is equal to what? These 3 tablets per day times 5 days, right? Day will cancel day, right? You're left with 3 times 5, which is what? 15 tablets. If you are done, let me continue, please. Can I clean? So this thing is very, very easy. I. A day is 240 minutes. Yeah, 8 times. So for 5 days, good, perfect. That's the answer. That is if they want you to know the number of milligrams and start with patient. Are we together? So if you are done, please let me clean and continue. Yes. Come on, man. Are we together? Shall we? Yes, I'm cleaning the board, though. All right. Thank you for allowing me to clean the board. This thing is not cleaning anything. What is going on here? As immediately after this class, we rush and get it. Get past question from us. Say that I sent you. That we need it in our calculations. We want to get some questions. So to solve some calculations so that you get familiar with it, okay? Because this calculation is going to expose a lot of things. In this thing, I didn't see all those some things, but if I start solving this thing, it will start bringing out something. This now, we bring out a formula used to calculate the children doses. That's why I want to see a past question paper, okay? To give us direction. Am I communicating? So that's why please ensure you get it. Thank you for this question, okay? Ensure you get that past question paper. It's very important for us. Now, the next thing is the second part of the question. Says what? Says that we calculate the what? How many meals? Now, let's go back to the question. The question said that they take. Excuse me. Okay, 1 second here. All right, now, the question says, if 1 tablet of phenobarbital is 80 milligrams, and a community health officer prescribed that a patient should be given a tablet in a teaspoon 3 times. So that means 1 teaspoon is going to be given what? 3 times a day, right? Now, the first thing to do is 1 teaspoon. You can use the symbol TSP, right? It's equal to what? 5 ml. 1 teaspoon is what? 5 ml. So what it implies is that number of meals to be taken a day is what? Therefore, number of meals to be given or to be used. Sorry, used, not given. Used. Because you are used to do what? Dissolve it, right? In a day is equal to what? 5 ml times what? 3 times, right? Which is what? This should be 5 ml per time. Hope you know. 5 ml per. Hope you know. But let me not confuse you with that. 5 ml. Did this give us what? 15 what? Ml per what? Day, right? Therefore, number of meals to be used for 5 days is equal to what? 15 ml per what? Times what? 5 days, which is what? Day will cancel day. We have what? 75 ml. So we need 75 ml to dissolve or disperse the one that the phenobarbital, this thing you need for 5 days. Is it clear? So 15 ml of water is what we need to give it the one that will be enough for that 5 what? Days. Odolanya. Good. We have discussed this too. I'm just writing down for those that for the weaker brethren. Those that they find it difficult to articulate it and logically arrange it. That when I'm writing this, in a class you carry everybody what? Along. Everybody along. So nobody misses out. So this is for them. TSP means what? Huh? Teaspoon, right? Good. So, okay. So are we together? Shall we? Continue? Good. So I'm cleaning, right? All right. Now let's go to what? I. The I say that we should calculate the what? The milligram of phenobarbital that we needed for that. We know. We have already established that a tablet contains 80 milligrams, right? Then for that 15 days, how many tablets do we need? Remember we have done the calculation, right? How many tablets for that 5 days? I mean, how many tablets for that 5 days? Let's take it step by step for the weaker brethren. So, now, number of tablets needed for the 5 days is what? For the what? 5 days is what? 15 what? Tabs. Yeah? Now, but one tablet contains what? 80 milligrams of what? Pheno what? Now this marker, what is going on here? But one tablet equal to what? 80 milligrams of what? Phenobarbi what? Stone. Therefore, 15 tablets will contain what? We call it what? X. Am I right? What do? We cross multiply, right? So that means X is now equal to what? 15 tablets times what? 80 milligrams. All over what? One tablet, right? So tablet will do what? That's 2 tablets, right? So the X is now equal to what? 1,000 what? This can be milligram. If you want to convert it to gram, it becomes what? Divided by 1,000, it becomes what? 1.2 gram. Or what? If you convert milligram to gram, it's what? You divide by what? 1,000. And you get what? 1.2 gram. So, but we need 1,200 milligram of the what? But now the question, remember, you see, don't just tell me this thing is wrong. It's wrong. Do you know why it's wrong? What did the question say? So leave it in what? The question is specific. Also, how many milligram of what? So the answer is what? 1,200 milligrams. So for the 5 days, as you are giving the baby every day 80 milligrams in 5 ml, for the 5 every day, each dose you are giving to the student. Each dose you are going to give to the patient is how many milligrams? Each dose. 80 milligrams now. How many doses in a day? 3 doses a day, right? So that 3 doses contain how many milligrams? So 5 days is how many milligrams? The fourth part of that question. How many doses? I'm exposing you to something. IV. IV. How many doses? How many doses of phenobarbital is needed for that 5 days? How many doses? Let me know people that think smart. Who can tell me how many doses? Who can tell me how many doses? How many doses in a day?
3 times.
Doses. A dose is what? 5 ml, right? So how many doses in a day?
80 times 4.
Yeah, I made a mistake. Dose is not the same thing with the milligram. I said dose. How many doses?
3.
A dose is that 5. A dose is how many milligrams? A dose is okay. Now let me catch you. A dose is how many milligrams?
8 milligrams.
A dose is how many ml?
5 ml.
A dose is how many ml?
5 ml.
Good. You can look for a dose either in ml or in what? Milligram. So a dose is 80 milligrams. A dose is also what? 5 ml. So how many doses in a day? 3 doses in a day. So how many doses for that 5 days? 15 doses. So we have learned how to think of how to do calculation in what? You have amount in milligram, weight. You have learned how to calculate the dosages in what? Weight, volume, dose, and what again? Number of what? Number of the what? Dosage form. True or false? Number of the tablet, right? By number, by weight, by volume, and by what? Dose. All of sides. No sides there. By weight, by volume, by number, and by what? Dose. So how many tablets per dose?
1 tablet.
How many tablets per dose?
1 tablet.
How many ml per dose?
5 ml.
How many milligram per dose?
8 milligrams.
Odanya? Yes. Good. We have touched a lot of things using this simple question now. We have touched a lot of what? Things. So if you hear dose, hear all those, don't get confused, okay? Did I define a dose in this class? I said that a dose is the amount of drug given, is the amount of medicine or drug given at a particular point of time to achieve a particular therapeutic what? Effect. A dose of a drug is the amount of drug that is administered to a patient at a particular point in time to achieve a particular therapeutic what? Effect. True or false? Am I communicating? Any amount you give at a point in time is the dose to achieve a purpose, a therapeutic what? Effect. Is a what? Dose. So the amount here now, it can be the number of tablets you give area at a point in time. So I'm asking, and if you go to pharmacy or not a pharmacy, if you go to some chemist shop, they will tell you they want to give you 1 dose. You mean give a dose bar? And they may tell that they'll give you 3 doses. That means they give you 3. The one you take 3 times, it will finish. True or false? That's the meaning. So a dose, like if you have headache now, if you have, let's assume now you have headache, and a prescription now says take paracetamol 1 gram 3 times a day. How many doses of paracetamol will you take in a day? A prescription says take 1 gram of paracetamol 3 times in a day for 5 days, for example. Or for 4 days. Let me use for 4 days. 3 times in a day. 4 days. How many doses of paracetamol do you need for that for a day? 2 doses, right? How many do you need for the 4 days? 12 what? Doses. Now, how many? What is the number of milligram in a dose?
500. 1 gram, 500.
How many milligrams are in 1 dose?
500. Milligram.
Yes.
500 times.
Oblone.
1 gram.
How many milligram can you get? How many gram? Yes, I know. I say 1 gram. I know that one perfectly. I'm not asking you. How many milligram I want those? 1,000 milligram now. No, you know what milligram? Because a 1 gram is 500 milligram into 2. It's not true. 500 milligram. You as an adult, you want to take for a all of 2 tablet now. This tablet is how many milligram? So 2 is what? 1,000. That's 1 gram. Which is, so that is 500 milligram is how many gram? How many gram? Put it in the decimal. 0.5 gram. 500 milligram is how many gram? 0.5 gram. That's why 0.5 plus 0.5 will give you what? 1 gram. And that's why 1 gram is what? 1,000 milligram. So the number of the milligram of paracetamol in that one dose you took as an adult is what? 1,000 milligram. So how many doses? Okay, you've told me the doses. So do you now know the difference between doses? Dose. So you can look for, you can check the dose. You can calculate the number of ml if it is a liquid, if it's a drug even if it's a medication that comes in what? Liquid form. You can calculate the dose. How many ml that you see in one dose? True or false? You can also if it's in solid form like tablet, you can just check how many tablets in one dose. You can check how many milligram in one dose. Is it clear? So I think we have answered this question. So you can add that IV, how many doses, and do it yourself. I don't write that one. Otogonye belunu sell like an on. Ngwa, then and ka. That IV, how many doses of phenobarbital do you need for that 5 days? Calculate it yourself. I've said it in this class, so do it yourself. So if you are done, let's solve this question. If you are done, let me know so I can solve this first question. There's a formula I want to introduce there. That's why I also left it so that it will expose us to that formula on how to calculate the children doses. Before we can solve this question, I want to talk about pediatric dosing. How to calculate the dose of a child. Am I communicating? How to calculate the dose of a child. There are different formulas, but I want to just point out 3 formulas I want us to look into. Just 3 formulas. So after that, now you tell me the one that you think we can use to solve this question, okay? Tell me yourself. There are 3 formulas I want us to look into. They are simple to understand. You don't need to think too much before you identify them. The first formula is Young's rule. We have Young's rule. We have Young's rule. Wait. We have Young's what? Rule. Young. Young's what? Rule. We have Young's rule. We have Clark's rule. Clark's rule. Then we have BSA dose, pediatric dose formula. BSA pediatric what? Dose what? Dosage what? Formula. I want us to look at these 3. I'll state the formula. Then you yourself will tell me which one do you think we can use to solve that first question. If possible, you solve it yourself and get the answer without wasting time. Now, Young's rule states that child dose is equal to age of the what? Or simply child age, okay? Child dose is what? Child age in what? years over what? Over the same child what? Age. Still in what? Years plus what? 12. You multiply everything by what? Adult what? Dose. For child dose, the age of the child in years over age of the child, the same age of the child in years, plus what? 12. You multiply everything by what? Adult what? Dose. This gives you the what? The child dose for that what? Medic drug. Is it clear? Kenko. Which one? This one. This is plus. You say add. I said child dose is, according to Young's rule, child dose is what? The child's age, that age of the child in years over the child age plus what? 12. Everything you multiply it by what? Adult what? Dose. Is it clear? Is it clear? Now, I want to state the class rule. The class rule, in class rule is in class rule, the child dose. The child dose is weight of the child or child weight. Am I communicating? Child weight in what? Pounds. Over 150 what? Pounds. Times adult what? Dose. Adult what? Dose. For class rule is equal to what? The child dose. For class rule, child dose is equal to what? Child weight in pounds over 150 what? Pounds times adult what? Dose. Times adult what? Dose. This is Young's rule. This is what? Class rule. Young's rule. Class what? Rule. So if we are done, I'll clean up and write that. I don't know if I can squat and write. Can you see? Yeah. Okay, let me squat then if you can see it. Then we want to look at BSA formula. Using BSA pediatric dose formula. Child dose is equal to what? The BSA of the child. Child dose is equal to what? Child's what? BSA. What is BSA? Over 1.73 watts meter squared times what? Adult watts. This is child dose. This is BSA formula. This formula says that the child dose is equal to what? The child BSA. The child BSA over 1.73 watts meter squared times adult watts dose. These three formulas, I will explain why these three formulas are important. I will explain how they progress and which are going to use each of them. I want to tell you some clinical implications of this formula so that you understand why this formula and why we need them. I ask you a question whether you come across the acronym BSA. BSA means body surface area. BSA means what? Body surface area. Body surface area. Have you not seen how this question led us to this? That's why I say get more questions. You will see. I told you that what I saw in your outline is I don't want to go and start talking about what is not in your course content. But if I see your question, I'll see where your counsel is going to. It will expose us to different things. I think I said it in this class. So this is one of the things this question has exposed us to. If they can ask this type of question, that means they can still twist it. That you can use any of these formulas to solve it. They may even get to the extent of leading you to nomogram. Nomogram is a graph. It's a type of blood that they use to determine BSA, body surface area. You can check it up on your own. What's a nomogram? You use nomogram to determine BSA. Now, I want to explain something. This thing I'm about to say now will help you to understand this thing. You know that before now, after they will tell you, okay, this child is so 5 years. They will just use the year, number of years the child is to calculate and know the adult dose. It's not. It doesn't always go well like that. The age is not enough. So young Ruth say that we use what? The child's age to determine. Just get the child's age, divided by sum of the child's age and 12, and times by adult dose. You get the dose. But it's not enough. It doesn't hold in every situation. Are you aware that you may see two children? They may be of the same age. One may be 10 years. Another person may be the same 10 years. But one, the weight may be much. Another person may be what? He may even be underweight. True of us. You not say because they have the same age, you can't give them the same dose. You cannot work. For the child that with almost underweight, the drug will be too much for the child. True of us. The one that is overweight, the drug will not even do much. True of us. So you know that the age alone is not enough. Hello? Is it enough? That's what came to this class with. Class now say, okay, we need to use their weight. Hello? Their weight. Am I communicating? Then I say, okay, the child dose should be the child weight in pounds. You can convert 1 kilogram to pounds. 1 kilogram, I'll give you a conversion factor in case you see some question, even in your cancel exam. 1 kilogram is equal to 2.2 what? Pounds. Okay? 1 kilogram is equal to what? 2.2 what? Pounds. So that means if you weigh the child in kilogram, you can convert it to what? Pound. Using this formula. True of us, it's easy. Now, you now put it here. Let's assume a child came to your pharmacy, or maybe where you're working, not pharmacy, where you're working, and you need to check the weight, right? You know, check the weight in what kilogram, right? You can convert it to pounds by yourself. And now, divided by 150 pounds, times by the normal adult dose of that drug, you get the dose, that weight of that child can do what? Take. Now, weight is not enough. Weight alone is not even what? Enough. You also consider the body surface area of that child. Are you aware that there are some children that may be plumpy, but their weight is not even? True of us. Is it true? Is it possible? You mean somebody that is not that plump, but the weight. You see somebody that has body surface area. The same age. They may even be the same weight. It's possible. Because what actually constitutes the weight of a person? Is it the bone, or the muscle, or the fat? What's not fat? The bone, right? Now, but one has the body surface area of one is more than the body surface area of what? The other person. You cannot give them the same thing. True of us. That's what led to what? Taking the body surface area of the patient. That's using nomogram. You can calculate the body surface area. If we have time after this, or if you see more questions that will lead us to this, I'll teach you how to calculate what? Body surface area with time, okay? But just know that body surface area, they calculate the body surface area of the child. That's where this one comes in. That the child dose is what? The child body surface area over what? 1.37. This 1.73, this 1.73 is the standard BSA of an adult, a normal physiologic man. Are you with me? But they just put 1.73 here. I'm telling you what it means. Then you multiply by the adult dose. You get the what? The dose of a child using what? BSA. Is it clear? Now, from these three formulas, which one do you think we can use to solve this question? Youngsu, right? All right, let's solve it. Let's solve it. Any question? Ask.
Does it mean that, as you said that
Yeah.
So this is that in this classroom, that 150 pounds is the...
Check here. Do it yourself and check whether it's true. Do it now. If 1 kilogram is 2.2 pounds, so how many kilograms will be 150 pounds? Do it now. It's not a physiological man should have weight of how many kilograms? See. Physiological man should have the weight of how many kilograms? Some tests will tell you 70, some will tell you 72, some will tell you 68, 69, within that range. So do calculation and let's check whether it is true. Good morning, sir. So what's the answer? Just do 1 kilogram is 2.2 pounds. Therefore, how many kilograms should be in 150? Which S should be 150 pounds? Answer what? So, what does it tell you? So this is within the range of the weight of a physiologic man. So that's what it is. That's what it is. Is it clear? Is it clear? Now what it is, and it is what it is. Now let's continue. So now we're using Young's rule. Any other question? Because we are entering the calculation now. So we are going to use Young's rule to solve this question. We are going to use Young's. So let me clean. Hope you put this in down. Have you? Have you put this in down? So let's clean this and use Young's rule to solve this question. I believe that if they twist this question to answer that you will need class rule, you will know, right? You will know, right? Please don't forget to convert your weight to what? From kilogram to what? Pound. Don't forget that. That's why I gave you this. So let me clean it from here down. So what's the answer? Have you solved this? What's the answer? Are you sure? So let's see whether it's true. So using Young's rule, the child dose is now equal to what? Child egg is what? Over what? 3 plus what? Times what? Adult dose is what? So the answer is what? Times what? 5. 3 go here, right? 5 by this. So the answer is what? Therefore, the child dose is what? 50 milligrams. Therefore, the child dose is what? Is this right? Yeah. It's very, very easy. I mean, as we have this question, let us do this. That's why I want you to look for more questions, more calculations. Let's solve. From now till you write the exam, if they will come here, I want you to give me at least 1 or 2. Let's solve it. By the time we solve enough, it will expose a lot of things that is not even in here. You know, sometimes these food are set questions. Sometimes they may just be setting questions. They may even leave here. It happens once in a while. They may leave what is in the words. They will this thing. You should know that this curriculum they review it. Maybe by the time they will review it again, now you see this enter them. You see it explained there. They will add more because the need for you to know these things is increasing. As Kachine, for the need for you to know these things will be increasing. From what your colleague meet in the what field, you will inform them what they should add because it keeps growing. It keeps what? Growing. The area you should know in pharmacology don't worry. By the time they will do another review, they will add more topics on that pharmacology. Bet me. Because there are some things as a pharmacist, I know that there are some things you should know that is lacking there. I know. There are things you should know that is lacking there. I know that one perfectly. Because you don't know where you see yourself. You see yourself where there's no doctor. Where there's no pharmacist. And where there's no nursing officer. What are you going to do? And that patient must be saved. So your pharmacology should be rich. at least. So you can help to solve problems. That's why we have you at the community level. Very important. So that is the. Any other question? Let's stop. Oh, yeah, we'll bring it on. One group. What they ask there? Are you the question?
I said that a student is asked to set an IVF, normal saline.
Drip rate. I think we'll do that one. We'll do it. I'll teach it. Yes, I think. But just answer it. I'll just use this question to. Are you with it here? Write on the board, please. Thank you. I like what she's doing. I think what I want you to be doing. You should know all this. You should know drip. You should know drip rates. You should know about what? Drip rates. Very important. Very, very important. You should know them. Very important. All right. Let's look at the question. The question says, a student is asked to set IVF. What do you mean of IVF? Of what? Normal saline for 8 hours. Calculate the drop per minute. The drops per minute. Something is lacking in this question. It's not complete. They didn't talk about the volume or how many drops in that 8 hours. Something is lacking. The volume is not there. Something is lacking in that question. Check the question well. You cannot say drops per minute. How many males are in a drop? Check the question properly. Are you in Facebook? Where it is? Are you with the go back to that group? Is it a group you belong to? Search it here. In what data? Search it. Bring it. I like that. Upload TikTok, man. You know, equip yourself with something. Do something meaningful with your data, okay? I like that. That's good. Always some of you on TikTok. TikTok. I know all of you now. I know you. Should I point you? Should I point? I know TikTok babies. I know you. But in a TikTok, try to look for something that will help your profession in that TikToking. Okay? Yes, try. If you spend 30 minutes, if you spend 30 minutes doing Kedafia, going live or dancing or I know them and they're looking at me. They're looking at me now. I know them. They're looking at me. Imecha, bring out another 30 minutes to check. Search that TikTok. Go and change your preference, your interest. You can change it to health or whatever preference. You see, the algorithm will be sending you some things that has to do with your interest. Is it clear? You can talk of maybe if you go to your settings, go back to that. You check settings on. You can put into your interest in where the line you are in. You start seeing things, educational these things that will help you grow. As long as somebody go, where you go, maka, is your talent. But at the same time, know that you are being trained here. Are you training as a dancer? You are training here to save life. True of us. By in health-wise, true of us. People still save life by entertainment, true of us. There is kike na agba ego ma kike na-eme comedy amụchacha at least for that time are going to happy. You save life in your own way, but you are trained to save life here through what? Health. So you should, anything you are doing, don't deviate from it. That's the point I'm making. I do a lot of things. I do a lot of things. I act. I sing. Yes. Yes. So the point there is that in as much as I do those things, I try not to be distracted from the main core. It's very important. And that's why I'm going to skip now. No time for skits again now. You don't want to skip. Skit is just a short video of maybe a short maybe acting maybe in a short just 4 or 5 minutes is a skit. It may be comedy. It must be comedy. It may be comedy. It may be tragedy. It may not be comedy. But the point is that it's very short, within 5, 4, 6 minutes. Did you see the group? So copy the question as it is in the group. Let's solve the question. As we can see now from the question, I said that the drip rate talks about the rate, the time, sorry, the amount of the drug that leaves the drip set into the pass through the tube, the IVF or what have you, pass through the drip set into the veins over time taken for you to enter the system. Now from this question now, as you can see 500 ml now. Now if you set a line for this normal saline, which is 500 ml in the bag, and you set it and take the time. You set it and go your way. Let's assume you come back. You took it 1 hour, for example, now for all the infusion to enter the patient's system. It took the whole 500 ml to enter the system. You check. Let's assume it took 1 hour to enter the system. If you want to calculate the drip rate, the rate becomes what? That 500 ml over what? The time it took to enter the system. Is it clear? That's the rate. But it's not the same thing with what? Drip factor. Drip factor. Drip factor. Drip factor has to do, in fact, if you have access to drip sets, drip giving sets, try to look at the tubing. Drip factor is written on the watch. It will tell you, drip factor tell you how many drops a particular tube can deliver per minute. That tube we are using, how many drops can it deliver? How many drops of this normal saline can it deliver per minute? That gives you the drip factor of that tube. Is it clear? Drip factor of you know what is drip set is now? Good. Each of the drip sets, they are not of the same size. They are measured, they are graded by their drip factor, DF. Each of them, all of them are not the same thing. So, you know the drip set is one that delivers the drug into the what? Vein. Now, you through the what? Cannula, yeah? Or what? Scar-vein, right? Now, all of them don't deliver the same drop per minute. The drop they deliver differ. And they write it on the what? The tube. So, drip factor has to do with the tube, how the tube is graded. How many drops can this tube deliver per minute? That's the drip factor. And this is peculiar for a particular what? Drip. There are some that will deliver so many drops per minute, depending on what you want to do what? Achieve. To determine the type of the drip factor of the drip set you want to use. There are some that may deliver 50 drops per minute. There are some that may deliver 100 drops per minute. Go on with the one you want to do what? Use. Is it clear? Is it clear? So that's what I mean by drip rate and what? Drip what? factor. So drip factor is just number of drops per minute. Drip factor is number of, write it down. Drip factor is number of drops a particular drip set can deliver in a minute. Simple. The formula is what? Drip factor DF is equal to what? Number of drops over what? Minutes. Simple. That sit up. That is not how to sit in class. You are like, if you lie like this, you get lost. Sit up so you not get lost. I said that drip factor can be defined as number of drops a drip set can deliver per minute. Is it clear? Number of drops of the drug in question now, right? A drip set can deliver per minute. The formula is what? Is equal to what? Over what? Per minute, over minute. Now, what it implies that each drip set, they could DF. I said that DF, from what I said now, what do you think should be the formula? Let me. For what I just explained now, what do you think should be for? Let's discuss it together. Don't be afraid. Just tell me. From what you read what you read. Let me see.
So that this factor talks about the number of drugs a drip set can deliver
per minute. So from this thing now, what do you think should be the formula? DF is equal to what? DF is equal to what? Number of drops over time. Number of drops over time. But the time should be what? Minute, right? So simply say number of drops over 1 minute, okay? Or per minute. Is it clear? Good. Now, but by the time we start calculating, what is it?
Sir, you said is the number of drops that set can.
It drips they can deliver per minute.
I thought drip set is to
Set it to where?
so either lower or
Lower.
yes. When you are doing the concept.
Assignment. Do you ever say to hospital now?
No.
When else will you go there? Who will bring drip set for us here in our next class? Bring drip set. Let's look at it. You can bring. Let's see whether they're the same thing. Like I said, even at this whole thing, as they goes by, keep changing. It's possible that you can still adjust how they. But I want us to get 1, 2, 3. Let's look at it. Let's study them and see whether they have the same tubing. We call it the tubing size. The tubing DF has to do with the tubing you are using. The number of drops they can deliver per minute. Let's check. There are some that can deliver 50 drops per minute. There are some that can deliver 100 drops per minute. They are not the same thing. But just get it. Let's check whether it's mainly by just adjusting it or whether it is written on it. Am I completing? So let's go practical now. Okay? I think with that you can appreciate it better. Now, this is what drip factor is all about. Now, having that about the back of our mind, let's solve this question. The question says, you are asked to set normal saline 500 ml to drop for 8 hours. How many drops are you giving to set? Are you going to set IV line per minute? Ask me again. You are told that they want you to do what? To give 500 ml in what? 8 hours. For you to deliver exactly that 500 ml in 8 hours, you need to set this into a factor that you can easily achieve it in 8 hours. And for you to do that, 500 ml for 8 hours. 500 ml for 8 hours. How many ml per minute? How many ml per minute? They say they want you to drop for 8 hours. It's not true. But they want you to drop for 8 hours. Now, 500 ml. If you want the entire 500 ml to be delivered in 8 hours, how will you know this thing now How many meal will be delivered in 1 minute? Check it. It's simple.
So we convert the hour to seconds.
Shall we? Wait. Calm down. Wait. How many meal? Drift factor. How many meal? How many meal per minute? How many meal per drop? No, this is not drift factor. Because it has to do with how many meal per drop. Anything over time is rate. Anything over time is what? Rate. Anything over time is what? Rate. Drift factor I'm no business with. Drift factor is over how many drops should be delivered per meal. That is the drift factor. But this one, they want you to know how many drops per what? Minute. And for you to be able to calculate this drop, you must know this drift factor of the what? The tube. Hello? What are defined as the drift factor? Please. Sorry for that error, please. I'm quickly looking at it now. If you look at this critically, this question, something is lacking at this question. They didn't talk about, they didn't tell us the drift factor of that tube, of the IV you want to use. Hello? Drift factor talks about, whatever I said about it is that an error. The drift factor talks about how many ml can be delivered with respect how many drops per ml. Drift factor is drops per what? Ml. How many drops is in 1 ml? I'm coming. Hello? Please, hello? The error I want to correct is this. That place you're good, number of drops. So please, this minute should be what? Male. Please, change it to male. The SI unit, the unit is what? GTTS per what? Male. That's the what unit. GTTS per male. Number of drops per male in a per male. So that means number of drops delivered by a male of that's what the drop factor and the drift factor. This is what I say that is contained in the watch. Where is she? Someone asked a question about adjusting. Whether you adjust, you adjust or not. The drift factor is embedded in the watch. In the watch, the drift you are doing, the step you are doing what? Using. Am I communicating? Now. That's why I say something is missing in this question. Something is what? Missing in this question. Unless they want us to find this question using traditional way of using measurement of drop. You know that drops can be converted to ml. I think one drop is about 0.06 ml. One drop is about 0.0. What do you say now? Yes, some people will say it's 0.06 ml. One drop is about, unless they want us to use that traditional conversion way. Fine, we can use this to try. But apart from that, the drip set should have a what? Drip factor for that what? Drip set. But even at that, this thing should have drop factor. The drip set, they should have what? Drop factor. But let's assume they didn't give it. Let's convert the ml to what? Drop. And bring it down to what? Minutes. And then number of drops that are delivered in a what? Minutes. Ever see an some of them means if 1 mil. But do you understand the drip factor? Have you made correction?
Yes.
Eh? It's not per minute. It's what? Drop per what? May please change it. I beg you, change it. Please, that's an error from me. Change it. Now, the point I'm making is this. The point I'm making is this, that if you have 500 mil, we have 500 mils. 500 mils for the whole this thing to be delivered. Now, 500 mils should be delivered in how many hours? 8 hours, right? And I told you that you can convert this mil to what? Drop. Let's assume the limit. You can convert mils to what? Drop. Some textbook, as I said, will tell you that 1 mil is equal to how many? 1 drop is 0.06 mil. But I want someone to Google it. Check Google. How many mils are in one? How many drops? How many mils are in 1 drop? Just do it sharp. Just write how many mils are in 1 drop. Let's see what it gives us. Just make it sharp. How many mils are in 1 drop? Some will tell you 0.005. Some will tell you 0.05. Some will tell you 0. I think we should use 0.05. It's more common. Let's use 0.05, okay? Let's use, if 1 drop, hello, look at this now. If 1 drop is 0.05 mil, 1 mil is how many drops? If 1 drop, do it now. If 1 mil is 0.05 drops, if 1 drop is 0.05, if 1 drop is what? 1 mil is how many drops? Just divide 1 by 0. She 20 drops. If I only 50. Just do 1 divided by 0.05. Is it confusing? Yee. If 1 drop is 0.05 mil, 1 mil is how many drops? That's not confusing. Awesome, okay. Do it now. Just do it. It's simple now. X is now 1 mil. Though you call multiply and find it. It's not true. It's 20 what? Drops. So that means 1 mil should give you what? 20 what? Drops. Now. So if 1 mil is 20 drops, how many drops are in 500 mil? Are you aware that 500 mil is just not saying 500 times 1 mil? True of us? Are you aware? Yes. Are you aware? No. Are you aware that 500 mil is just not saying 500 times 1 mil? Yeah. Huh? And we calculated that 1 mil is what? 20 drops. So wherever you see 1 mil, you put what? So that means 500 mil is equal to what? 500 times what? 20 what? Drops. Which is what? Remember, everything is over 8 hours. Yeah? It's what? 10,000 what? Drops over what? 8 hours. We have moved mil to what? Drops. True of us? Then move 8 hours to minutes. What's the answer? Move 8 hours to minutes. How many hours? How many minutes are in 1 hour? How many minutes are in 1 hour? Sister Chobani? David? I start guys. David, guys, start guys. Good. About now 1 drop. 0.05. So convert what would 1 mil be? 20 drops of gas. Our target is to convert 500 mil to drops. That's our target. Because do you believe me that 500 mil does not take 500 times 1 mil? Do you believe? That 500 mil does not take 500 times what? 1 mil. Do you believe? Is that ready? Let me round up. I'm good. Do you believe, sister? Now, if you slide it into 2 now, this is 1 mil. The operation between them is time. This is 1 mil. 1 times 500 is what? 500. above 500. Okay, let's assume 2 is here. That you must tell me. How many mil? And so if 1 is here, above it. Oh, let me. Is it clear now? If 1 mil is here, above it, 500 mil. So this is 500 mil does not say 500 times what? 1 mil. Some of you are looking at it and confused. Huh? What is it? Tell me what is it? I want to know. What is it? Tell me what's the issue? Tell me, let me understand the issue. No issue. You okay? Please, who is lost? Let me know. Who doesn't understand what they're doing? Let me know. Just say it. I will not ask you. I will just explain. Say it. Don't be afraid. Say it. The people at our agenda that know what they're doing and I'll continue. What is it? What is the issue? Where do you? Yes. Okay. Drop. One mil. Two drops. 20 drops. That was 20 drops. That's what we did here now. That's what we did here. 500 mil, 500 times, that's 1 mil, which is. Okay, we never did do it well. We never did do it well. About 500 mil, yeah? Over what? Which is what? 500 times what? 1 million, yeah? Which is what? 500 times 20. This is 20 drops. 20 what?
Drops.
Is it clear? Is it clear?
Yeah.
The 500 times what? 20 drops over what? 8 hours. Which is what? Yeah, 10,000 drops. Sorry. 10,000 drops per 8 hours. But you are looking at it per what? Minute. So we convert 8 hours to minutes. How many minutes will we? If okay, there are 480 minutes in 8 hours. Okay, now so we change this 8 hours to what? 480 what? Minutes. So this will give us what? 10,000 watts. Drops over what? 480 watts. Minutes. So what's the answer? 20 point what? 20 point what? 8 drops per what? Per what? Minutes. 20.8 drops per what? Is it clear? 20.8. The people says, how many drops are you going to sell the IV line per minute? So you are going to sell the IV line to give you what? 20 drops per what? Minute. Is it clear? Is it when someone asks me that minute, where is it from? We move hours, 8 hours to minutes. So how many minutes are in 1 hour? So if there are 60 minutes in 1 hour, how many minutes will be in 8 hours? Is it clear? So that's why we change it to what? 480 minutes. Okay? So that means you will adjust it to what? To give what? 20.8 watts drops per minute. Have you not seen? This is also rate. Hope you know. It's rate. Hope you know. We just converted. Drops is a measure of volume. Hope you know. That's why we say that 1 drop is 0.05 ml. It's volume. Hope you know. So it's rate. So this is rate. It's not the rate factor. Who has that question? You can only adjust rate. You cannot adjust the rate factor. This factor is on the 2. Is it clear? So this factor is the number of drops per minute. This thing can do what? It's on the 2. Go. So now, everything we move here is what? 20.8 drops per what? Minute. So the answer is what? So for you to deliver the entire 500 ml in 8 hours, you must adjust the drip set to deliver 20.8 drops in what? In a minute. That's the answer to the question. So answer that question to them. Answer it and drop the answer. 16. 60. Did they write how their solution? Let me see the format they use. So, you know, I said initially that there should be drip factor for that what? Drip step, but they didn't include it. So I just used converted ml to what? Drops using the conversion factor. Okay, answer. Any question?
No.
Old what? Old what? Talk now. Old standard. Okay. Because that term, I looked for the drip factor, I didn't see. But they should give it for the other drip. So that will help us to know how many drops that tube can deliver per ml. Ask.
I want to understand the difference in the drop factor and the drip rate.
Okay.
When you said the drip,
Yes.
so this is that the drop factor,
Mm-hmm.
is how the drip, as in the content of the drip, is how dropping directly into that tube. Then the rate now is how you adjust that rate as one law.
Rate has to do with time. Oh, what you see me? That's how you do. That's how you adjust it. It's very fast.
That's what I'm saying.
That's rate.
There's a factor there.
Factor is embedded in the tube you are using. Factor is embedded in the tube you are using. Each different tube have different drip factors. Some call it drop factor, DF. Different. That's why I say you should bring drip sets in your next class. So look at it and check whether it's true or what. Not that different tubes they have different words. So it depends on the tube we are using. So we bring it and check it. That's what I want you to do. But that thing you are adjusting is the rate. After adjusting, it can be fast, very fast, or very slow. On rate now, the volume that enter over time. If you make it to be fast, that means large volume will enter in a short period of time. So the rate will be fast. It's not true. Then if you adjust it to be slow, then small volume will be delivered in a long period of time, making the rate to be what? Slow. So it's drip rate. That thing is drip rate. So even this thing we got is drip rate because we are adjusting it. Is that not what they said here? It's drip rate we just calculated. Overall drip what? Factor. But, okay.
With this, the first one now, does it mean that we first of all got the drip factor before getting the drip rate? Because they said drip factor is number of drops in a minute. Number of drops in a minute. If you use that the first formula, it's still the same thing.
Listen carefully. I like the question you asked now. That time we said that 1 ml is equal to what? 0.05 ml. This is. So let's start from drop. 1 drop is what? 0.05 ml. This is drip factor. Mana. All the wrong, I hope you know. Every tubing that will have this, depending on how the tubing is. I just use it because I from anything. Maybe that 15 there. Maybe that may be the drip factor of that tube, but they didn't include it in that question. Are you with me? That tubing, that 15 you saw there, may be the drip factor of that what? Tube they used in that question. But they didn't include it in the question. Maybe that's where they got, okay, let's assume. Let's see whether we can get the same answer. Let's assume, maybe we are looking for where they got 15. Let's assume that the drip factor is what? 15 drops per mil. Let's assume, okay? Let's assume that the drip factor for that tube is what? 15 drops per mil. What it means is that 15 drops is equal to what? Up here? It's not true? Absorption. Because from what they saw, they just got 15 from nowhere. And immediately I saw this because I told you that drip factor is missing, right? Maybe let's assume that's what they got at 15 and put in before solving. Let's put it as whether we will get the same answer with them, okay? Now, if drip factor is 15 drops per mil, what it means is that there are 15 drops in a mil, which means wherever you see 15 mil, wherever I see 1 mil, you put how many? 1 mil, we put how many drops? So put 15 drops there. Let's see what we will get. Okay, Eva, 500 times 15 is what? 500 times 15 is what? 7,500 of here? Yes. Then divided by 480 of here stress. It's not true. 7,500 by 480 divided by 480 is what? 15 point what? 625. And they got what? 16. They appropriated it. Didn't notice anything now. Immediately I saw this question. My first statement is drip factor is what? Missing. So they use drip factor as what? 15 drops per mil. And that was why I said that the question is not complete. Here general this. Remember I told you that each drip has its own what? Drip factor. Maybe the one for the drip they used is 15 drops per what? Minute. I just use traditional way of, but which is not that perfect. Because you are not talking about drip now. Specific drip has its own what? Drip factor. So maybe the one they use is 15 drops per mil. I told that some may be 50 drops per mil. Some may be even 100 drops per mil. Depending on the one you are using. By the time you get drip sets in our next class, these things will be clear. Is it clear? Udaya? So please, let us not stress it more. Just from the question we just did general thing by saying that 1 mil is 0.5. But they used drip factor. Their drip factor they use is what? 15 GTTS per watt. This is the drip factor they use. This means 15 drops is equal to what? 1 mil. That's the meaning. So you can, if you understand it this way, I don't think you have any issue. I just pray we'll see a question that will give a drip factor before we solve it. Maybe I'll give you a material on this drip rates, okay? I'll give you a material on what? Drip rates. I think I have a material I want to give you. Just go through it. It's not the same thing with what I've been saying here, since you can solve as many questions as you can on that. I think this lecture has actually... Hey. Do you now understand the concept of drip rate and drip factor? Remember the mistake I made? I started saying that drip factor is drop over what? Minutes. That is wrong. Please correct that. Hope you've done that. So it should be drop per what? Mil, not drop. And I said that the drip factor depends on the tube we are using. Each tube has its own drip what? Factor. All that drip factor can just convert as a mil to drop. Whenever there is a rate of number of drops that you can adjust it to drop per minute. Is it clear? So maybe they give. Let's assume now. Let me give you a practical issue. Maybe You are working with a doctor, a medical doctor. You say, the doctor, they write in the prescription and say, please, that this prescription now say that you should set a line for a patient. Let's assume you were asked to set a line. You know, I like practical questions. You are working with a doctor in a community, in a remote community. Go out with only someone that has something that has to do with nursing. Do they teach you how to set line?
Yes.
Are they supposed to teach you?
Yes.
No, are they supposed to teach how to set line? Legally, officially, legally. Good. Yes, legally, by law, not by jumper, by law. Now, you know there are some things people we do in this profession that is not even what you're supposed to be doing. Hope you know. So a doctor have no business with having stocking drug in his shelf when he should employ a pharmacist that should do that. Hope you know. Yes. So this country is messed up. People encroach, do what they shall not supposed to be doing. That's why I say by jumper. By. It's not his field. His work is not to sell drug. His work is not to dispense drug. His work is to diagnose a patient, get the lab, clerk the patient, look at the patient's signs and symptoms, clerk the patient, question some of these things, send to lab scientists. They'll get the results. He will from what he observed in the patient and from what the lab result is saying, he will take a critical decision and diagnose that this patient is suffering from so. That is work. Then if he's a surgeon, he can undergo what? Surgery. A general practitioner may undergo little minor what? Surgery. Three of us, that is their work. Their work is not to be carrying drug up and down. It's not that is the work of a pharmacist. But this country, everything goes. Okay? The same thing, pharmacist's work is not to be giving injection to patient that comes into the pharmacy. It's not your work. Hello? It's not your work. So pharmacists, like I am now, I can inject, but I don't do it in practice. I learn it by jumper. Because some situation may call for it. Hello? But not that I will just sit down and be injecting patient in my pharmacy with boldness. It's wrong. I can't do that. Okay? It's not my this thing. It's not. Just like a medical lab scientist stocking drug in his lab. It's not your work. Diagnosing a patient, writing diagnosis for a patient. It's not your work. Your work is to carry out tests on the specimen, package the results, send to the doctor, or give to the patient, said to the doctor. That's your work. When I hear we do a lot of things to succeed. But that's wrong, okay? It's when you have problem, when you enter trouble. That's when the law will tell you, oh boy, this is not your work. You go to jail for it. You have no license to do this. In the license of the pharmacy, there's no place they say inject. It said import, export, compound, dispense. No inject there in your license as a pharmacist. So that's what my license covered me to do. So let us not go there. I just want to talk about ethics a bit so we understand what we are doing. That's why I ask you legally, are you taught by law, by everything, how to set line? If it's what you are taught, if it is in your line, it's okay. No, the point I'm making is let's assume you are told to set a line. The prescription says 500 to give this, that if you have 1,000 ml or 1 liter of normal saline, that this 1 liter of normal saline must be delivered within 10 hours. I hope you know I've already set a question now. I will set a question though. That the question says, ask you to set a line to deliver 1,000 ml or 1 liter of normal saline to a patient over what? 10 hours. You are now asked to, how many drops will you set at just the what? the drip set to be able to to give how many drops will you adjust the set to give in 1 minute. Do I call this it was the drip set actually use in your channel fuma came out drip factor of the drip set. It use it will matter. Is it clear? The doctor will not talk about the factor. Go accordingly in the drip setting they use. Model drip factor of the drip setting they use. So in the drip factor of the drip setting you are using, that will help you to know how many drops you can adjust it per minute, so they can deliver within that 10 hours. The whole 1 liter has entered the system. That was what it means. So if the drip for this question now we solve, if the drip set she's using now delivers 15 drops per minute per mil, that it means at the drops of 16 drops per minute, it says here the rate at 16 drops per minute. That means under 8 hours, the whole 500 minutes will enter the system. That's the meaning. So if that do about this, I'm getting delegate as a doctor. Set a line. This patient should be set a line for this patient. 1 liter of normal saline to be given over what? 10 hours. That's what you see in prescription. True of us who have seen it before. Over 10 hours. That's what you see. Yes. I thought you go for posting. These are things we check out. This is what you see in position. Normal saline 1 liter over what? 10 hours. Do you want to call this year? Do you want to say to you call this year? In the drip setting they use. One the drip factor. One how to set it. All the set telefuma 20 hours. Okay. The thing will still be dropping. Have you achieved the purpose? No. You've not. So for you to be able to deliver the whole 1 liter over 10 hours, you need to know the drip factor of the drip set you are using, so you can adjust it to social drops per minute. Or in that Ezaka, your question is when you are not adjusting that you know how many drops you want to adjust it per minute. That's the adjustment. The rate at which it will enter the system, because it enters in drops. That's when you know how to adjust it. Using as you adjust it, you will now help you to do it well. So that within 10 hours, you must have what? The 1 liter would have entered the what? System. I don't know if this thing I sat down to talk about makes sense. This is what the rate is all about. Okay? It's simple. With this understanding, there's no way they will twist a question you cannot solve it or answer it. Just have this basic understanding, and your life will not remain the same. Is it clear? Okay, ask. Yes. That's why you assume what I confirm. I'm not a Asi munu nke mbụ no asị na ịtụpụta nkịta akpị mee gịnị igosi ya wọta ya ka anyị malụ ma eziokwu ọ bụ na ọ bụla eziokwu anyị amalụ why ka asị ka na asịrịrị anyị ọkụ ya wọta ya ka anyị malụ ma eziokwu. That's why I say at least 3 different people should get sources from different sources ka anyị malụ ma eziokwu anyị na-enye ka malụ ma eziokwu. Okay, it's simple. What are in the okay? Of course, it should be in the pack now. In case they left the tube and wrote it on the body, just get it. Let's see. I'll confirm more. Open it. Are they happy over here? Yes. So I think with this, we've started it on now. Can you try? Okay, let's assume the drip factor of the. I want to divide the class into two. This class into 2. Some will solve. Some we set the line with a drip setting with drip factor of 50 drops per mil. Then some will solve with the one with what? Let's say 25 drops per mil. Let's see how many drops that we can adjust it per minute. Is it clear? That question you wrote now, setting a line for 1 liter normal saline over 10 hours. To finish, for everything to drop in 10 hours. So that's some. Let the class be divided into two. As I can divide the class into two. Some will do it using drip set that have DF of what? Group 1 we saw using drip that have DF of what? 50 drops per mil. Some will solve it using the one that has DF of what? 25 drops per what? Mil. Let's see what the answer you will get. In our next class, I want to see it. Is it clear? What is there you don't understand, Ezeka? What exactly you don't understand? Did you understand when I gave practical example that you will be asked to set a line for normal saline 1 liter? Did you get what I was saying that? Who got the question? Who got the question? Okay. So, it's okay. Anyway, I say you should. Why I stopped you? Hello. Why I stopped is that you said drip factor 50. Ask him not to divide the class into two. Some will use drip set of DF 50. Some will use 25 drops per. But that is not the question. That is addendum for your own group. I don't know whether you are the one that share the group. I said that she should share the group. Are you sure where you should be? You pick a 50. Group A should use what? 50. Group B should use what? 25. But the question said that you should set a line to deliver 1 liter of normal saline to a patient. 10 hours. That's the question. And I say that now. To set it now. To ask to conclude the question now, how many drops are you going to give? Are you going to set the IV per minute? The IV line per minute. How many drops are you going to deliver per minute? That's the question. But you need drip factor, yeah? So now the drip factor you use will not be the same thing. Group A should use drip factor of what? 50 drops per what? While group B should use drip factor of what? 25 drops. As the call is there, you use your arrange number, divide the class into two. Mbia the next class, you come up or go in group 1 and then group 2. So before you go to the know your group and do it. Know your group. If you are in group A, every other thing is the same thing, but your drip factor will not be the same thing. Group A should use drip factor of what? 50 per what? Mil. While B should use what? 25 drops per what? Mil. That's the question. Yes. Yes. This may not be ideal. Just what I just framed. Hello. It's 1 liter. Yeah. I say 1 liter in 10 hours. This may not be a day practical situation. Imagine your man normal 10 hours. 1 liter. I just formulated something here, so you can understand what you are doing. Okay? I'm not saying that I'm not saying it's feasible. I'm not saying it's not feasible. I'm just talking about what you want to use it to test how to do what? Do this what? Calculation. Simple. Okay, you have them now. Okay. Is it clear? So just do the what thing by in our next class. We'll look into it. Okay?
Yes, sir.
All right. Give me attendance to have you did not have attendance. You are carried away. All right, thank you very much for today. Any question? In the absence of any question, I will stop here for today. See you next time. God bless you.